Hey, it's Dr. Rucker here. I'm going to go over some slides to answer a great question posed by one of our patients. The question is, if the patient is going to use anavar and or nandrolone, do they need to use post-cycle therapy, and how long should they use the product for? First question I'm going to answer is the length of time. I find we are trying to monitor patients with clinical monitoring and safety monitoring. So I suggest patients can do cycles of 3 months at a time, and then we pay special attention to liver function testing and the other labs I have right here, hemoglobin levels, lipid levels. So I think it's very reasonable to do 3 months at a time. There is no large-scale studies to answer this question, so it's based on my experience and observation. I made some slides to go over various aspects of anavar and nandrolone, especially nandrolone. Anavar didn't make any slides, but it's really a gentle molecule, generally speaking. You take it daily, you take it orally, it's metabolized by the liver, and its prime endpoint, what the patients will notice, is a more of a muscular definition. So it has a defining and somewhat increased metabolism type outcome, but it's really pretty safe to combine with testosterone use in men and women, ironically. And for that matter, so is nandrolone. But anyway, anavar is a great agent for women who are starting, and anavar is great for men for the reasons I just noted. So on this slide, as you can see, this is physiologic, safe dosing practice, and the patients will take 25 milligrams anavar daily. Some of the patients very rarely might go up to 50, and the same concept for nandrolone, 100 milligrams weekly, and on occasion you'll get a 200 milligram user, but those are larger or more experienced users. I have a slide about post-cycle therapy, but there's no true need. I do think anyone taking these protocols should take a small dose of anastrozole to block conversion from testosterone to estradiol, and I discussed the next point, which is lab use. So I'm going to run through some other slides that I made on this topic. This is an interesting little study that you can find. I purposely got the title and the information. 2020 March. Nandrolone relieves joint pain in hypogonadal men. I redlined it, so you can see one of the nice things about nandrolone. You're seeing this information's starting to become published. Dr. Larry Lipschultz is a big advocate. He's one of the more knowledgeable professors in urology, so it's great to see mainstream professors publishing information and putting it out there that we are using safe, effective protocols that are actually approved by various high-level urologic professors. So this field is changing, as these next slides will give you this idea. Next, this one shows one of the chief effects in nandrolone, this called myotrophic androgenic activities. Testosterone's an index of 1, so nandrolone is an 11. It's exponentially more anabolic than testosterone, so that's why it works well. It is based on the testosterone molecule. The real difference you can see as I circle, there's a difference. This is a CH3 group. I think it's called a methyl group, and there's just a hydrogen. That's the only difference between the two molecules. Amazing. That one little difference makes it have a different effect on the body. You have to combine it with testosterone, because if you took solo nandrolone, your body will think it's testosterone. It'll drop your T level. Also of note, nandrolone falsely causes the lab to think you're on 3 or 4 times the dose of testosterone. So a testosterone lab check becomes almost worthless when you're on nandrolone. Hidden fact that I know through experience. Next slide. So on this one, you can see here, nandrolone was approved for the treatment of anemia, so that's why we check. Nandrolone by itself will cause the red cells to increase faster than testosterone, so definitely need to start donating blood. But you can see why nandrolone works well. In sick patients, it can help for bone loss, muscle loss in a COPD and HIV patients. So you take a normal patient, you're going to see muscle gain, and bone strength. So that's why it's beloved by athletes. Next slide. A lot of the data and knowledge on nandrolone is because it's been done in the setting of illegal androgen abuse. Bodybuilders are notorious for utilizing very high doses fraught with polypharmacy. So something bad happens like cardiomyopathy, coronary artery disease, you don't really know with the doses they're taking. It's unclear how these risks apply to nandrolone at a more reasonable dosage. Well, it's really not, because this is a pilot trial that they published. If you remember the first slide, it says they actually did a pilot study and reviewed the literature. So we're finding excellent safety data. Nandrolone is a particularly compelling medicine. They are focusing on the joint pain in this article, but it's great that we're getting novel indications for fascinating drugs with ever-expanding options in our portfolio. And the last thing, I pulled a slide from Post-Cycle Therapy for Bodybuilders by Furious Joe, whoever he is. But I like the point here. PCT is dependent on the patient's age, genetics, how long your cycle is, and which of the steroids being used. And in the case of how I'm utilizing for the patients, no real need for PCT. You can just stop the anavar and nandrolone, go back to regular testosterone usage, and you're just going to be continuously monitored the whole time. So I think it's very reasonable to do 3 months on, 6 months off, 3 months on, and kind of assess where each patient is. So that's my presentation. I hope that helps anyone who's seeking more answers in this area. And thanks for the excellent question.